If you live with a history of cancer, you've probably had your blood drawn a gazillion times, and that's probably not an exaggeration. I'm cancer physical therapy specialist Dr. Leslie Waltke. Welcome to the recovery room. Today in the recovery room, we're talking about blood. What does it do? What is it for? What are all those things that are inside it? Red cells, white cells, platelets. Why does your oncologist care? And when you comes out of your skin and goes into one of those little tubes, where does it go? What happens to it? We're going to check that out. But being your friendly neighborhood physical therapist, of course I'm going to throw in exercise somehow, always in every video. So here's my favorite tip. When you get your blood drawn, sitting around waiting for the results, don't sit around and wait. Have your blood drawn, then go for a walk. Walk the hallways, walk outside. They can text you when the results are ready. So, exercise like your life depends on it, because it does. All right, let's go check out your blood. Human blood does a lot of cool things. Oh, wait a minute, I'm not dressed. Wait, try again. Okay, all right, and now for the background. Cool, all right. As I was saying, human blood does a lot of really cool things. It transports oxygen and nutrients to our tissues, helps get rid of waste products, helps regulate body temperature and fluid balance, helps fight infections, and helps with wound healing. Our blood has two main parts, cells and plasma. Plasma is the clear, yellowy liquid part of our blood. Our plasma is mostly made up of water, but also contains proteins like albumin, gamma globulin, as well as sugars, fats, and hormones. The cells of our body fall into three main categories: white blood cells, red blood cells, and platelets. Our white blood cells are part of the body's immune system and help fight infection and disease. The different types of white blood cells include granulocytes, monocytes, and lymphocytes. When we don't have the expected number of white cells in our blood, it is called neutropenia. Having neutropenia can lead to the risk of getting really sick from viruses and bacteria. Now on to our red blood cells. Our red blood cells are also called erythrocytes. Erythrocytes contain hemoglobin. It is hemoglobin that is responsible for carrying the oxygen molecules in our blood. When we don't have the expected number of red cells in our blood, it is called anemia. Symptoms of anemia include tiredness, shortness of breath, and lightheadedness. And then finally, the third type of blood cell is our platelets. Platelets are responsible for forming blood clots, slowing bleeding, and assisting in wound healing. When we don't have the expected number of platelets in our blood, it is called thrombocytopenia. This condition may result in excessive bruising and bleeding. So now you can see why knowing about what's going on in your blood is really important to your cancer doctors. Blood tests can look for your blood counts, look for disease or things that cause disease, look for antibodies, tumor markers, or even assess if a treatment is working. And as you are most likely well aware, to do these tests requires getting some blood out of your body, commonly known as a blood draw. This can be done by poking a vein with a needle, or if you have one, by drawing blood from a port, a PICC line, or a central line. A common blood test you've probably had is a CBC. CBC stands for complete blood count. A CBC counts the numbers of the differing major cells in your blood, including red cells, white cells, and platelets. A CBC will also measure your amount of hemoglobin. If the hemoglobin level gets low enough, your physician may recommend a blood transfusion. A CBC will also measure your hematocrit. A hematocrit measures the amount of blood that is made up of red blood cells. A hematocrit looks at conditions such as anemia, dehydration, malnutrition, and leukemia. You may also be familiar with the term CBC with diff. This is the medical lingo for complete blood count with differential. This test adds in a bit more of in-depth analysis looking at more specific subtypes of blood cells like neutrophils, basophils, and eosinophils. Now, a blood chemistry test looks at electrolytes like potassium, sodium, and chloride, as well as glucose, fats, proteins, and enzymes. This information lets your doc know about how well your liver, kidneys, and other organs are doing. And the final blood test we'll look at is a blood culture. A blood culture looks for things that may be the source of an infection, like bacteria, fungus, or yeast. Information from a blood culture helps determine a good course of treatment or the correct antibiotic to use for that particular infection. So no, it is not pleasant to have a blood draw. Yet now I hope you can better appreciate the wealth of information it can provide to your cancer team. Like the rest of you, your blood is very important, so care for yourself well. I'm Dr. Leslie Waltke signing out from the recovery room. And remember, if you've just had your blood drawn and are waiting for results, take a walk. And then message me and let me know that you did just that. Let's talk again soon.